Hi everyone, in this video we'll discuss how to diagnose bacterial conjunctivitis. So let's start. So whenever you have patients complaining of symptoms like redness, watering of eye, grittiness, that is the feeling of sand particles stuck inside the eye, burning sensation, thick discharge, eyelids getting stuck to each other on waking up morning. Okay, these are the symptoms that are present usually in bacterial conjunctivitis. On doing clinical examination, the usual signs we see in bacterial conjunctivitis are eyelid edema, conjunctival congestions, mucopurine discharge, conjunctival follicles, sometimes even superficial portions of the conjunctiva getting eroded. Okay, so these are the signs that usually we see when patient has bacterial conjunctivitis. Before finalizing the diagnosis, we should go through the differential diagnosis to finalize the disease. On differential diagnosis, we'll compare the bacterial conjunctivitis with similar kind of diseases like viral and allergic conjunctivitis. Point number 1. Bacterial and viral conjunctivitis has milder form of itching, whereas in case of allergic conjunctivitis, the itching is very intense. Point number 2. Bacterial and viral conjunctivitis have mild or no photophobia, whereas the allergic conjunctivitis has frequent photophobia. Point number 3. Bacterial and viral conjunctivitis presents follicular reactions, and whereas the allergic conjunctivitis has papillary kind of reactions. Point number 4. Bacterial conjunctivitis have constant white mucopurine discharge, whereas in case of allergic conjunctivitis, you will have white stringy mucus discharge, and in case of viral conjunctivitis, you will have watery clear yellow discharge. Point number 5. Bacterial conjunctivitis doesn't present with adenopathy, whereas the viral conjunctivitis have adenopathy like swelling of preauricular lymph nodes. Point number 6. Bacterial conjunctivitis may present with otitis media infections, whereas the viral conjunctivitis may present along with pharyngitis, and allergic conjunctivitis may present with hay fever. Point number 7. Bacterial conjunctivitis are usually bilateral, whereas the viral conjunctivitis are usually unilateral. Once we come across all these similar kind of signs, symptoms and differential diagnosis of bacterial conjunctivitis, then we make the final diagnosis. Laboratory investigations are generally not required in case of bacterial conjunctivitis, but when the existing therapy is not responding well, then we may require gram staining, culture, PCR, or even antibiotic sensitivity report